Welkom bij weer een podcast van TCM-lover. En ja, meestal heb ik wel een Nederlands sprekende gast, maar vandaag gaan wij in het Engels. Ik heb namelijk een gast uitgenodigd, helemaal uit Zwitserland, en dat is Volker Scheid. Hello, Volker.
Hello, nice to be here. Nice to meet you.
Yeah, thank you for your time. When I was talking to Felix, he mentioned your name, and I knew already your name because I saw some little videos on YouTube, and then he talked also about Metapractice, and I never heard of the word Metapractice. So I went on my computer and I googled Metapractice and your name, and then I was really excited because we are training students in Chinese medicine, and I'm also talking about TCM, but also talking about Tan and Master Tung, and also the 5 elements of Worsley and the constitutional 5 elements. And there was somebody else who was explaining and bringing it together in Metapractice.
Well, I mean, it's a name that I came up with when I had to describe what I want to teach or what I'm teaching. So I had to come up with a name to describe what I do, Metapractice. But basically, what I'm trying to do is I've been doing Chinese medicine now for over 40 years, and one of the things that, as you say, everybody who gets involved with Chinese medicine for any kind of period of time, eventually they figure out that, well, there's not one Chinese medicine, isn't it? There are many ways of doing Chinese medicine. Yes, okay, in acupuncture, but also in herbal medicine. There's TCM, there's all the different jingfang styles, there's Korean acupuncture. So how do we negotiate our way through all of that difference? Most people, they just have to, I mean, we all find a way eventually, isn't it? Yes, more or less easily or more or less difficult, and has got something to do with who we are. Some people, they just like to do one, it's kind of like in medicine. Some people, they just specialist for one disease, and that's all they want to do, yes, for the rest of their lives. They only want to treat hip pain, and they're very happy to do that for the rest of their life. That's fine. But then there are other people who are a bit more like generalist. I see myself more as a general practitioner. I like to have people come to me with all kinds of things, and I also like, and then the question is, how do you know whether this is good for that or that is good, or how do you find your way around all this difference? And I've been thinking a lot about this. I've been basically thinking about this for over 30 years now.
Mm-hmm.
And this Metapractice course is the end result it's a work in progress. Yes, okay, but it tries to help people to work with difference. Yes, okay, not so that they feel they have to make a choice, like I have to choose this, or I have to choose this, or this is better than that, or this is better than that. But it's rather an attempt to start to feel comfortable and find a way of how you can actually use different things to a little bit of challenge each other, but out of the challenge get something more than the individual parts. Yes, okay. I hope that makes sense. I can explain that to you if you want to, with some concrete examples, if that helps. Yes, okay.
Yeah, please, because I talked a few years ago with Jan Schroen. I don't know, or you know Jan?
Of course.
Yeah, and I asked him, how do you diagnose? Because our company TCM Lover is is helping students with their diagnosis skills. And I asked him, how do you diagnose? And then he was looking inside him, he was thinking, and he said, it's happening in my head. And then I know what to do. And I thought, okay, is there no structure then at all?
So I think, like, if you look at diagnosis, for instance, like, okay, maybe you do, like, say I studied originally with the Worsley school, yes, a long time ago, yes, okay, so they do this 5-element constitutional diagnosis, yes, so everybody, the focus of all this diagnosis is somebody's constitution, yes, okay, and which people do have. I mean, whether you call it constitution or some people call it terroir or terrain, or there's a people don't get, like, some person gets migraines. It's very unlikely that, so they get migraines all their lives. Whenever they're in trouble, whether it's stress or whether they get a cold or whether they get that, eventually they end up having a migraine. Yes, okay. And another person, the weak spot is the stomach, so they get stomach issues. Yes, so it's not, as you know, it's not like you get a migraine this week and then next week you get stomach issues and the week afterwards you get period pain, and it's not arbitrary. Yeah, okay. So constitutional an approach can help you because it allows you to figure out the terrain where something happens. Yes, okay. And whether you use, like, I don't know, whether you use 5 elements for the constitution, or you can also use like the Liu Jing, the Tai Yang, Shao Yang. So we can do constitutional diagnosis with that, but you can also do constitutional diagnosis. Say it's more like I don't know. You can do TCM type constitutional diagnosis. This is more like a blood deficient person, and this is more like a heat person or whatever. Yes, okay. But when you do constitutional, that can be very helpful, but it also means you miss stuff, because, like, say COVID, when people get COVID, the COVID was a new disease for everybody. It's the same virus, isn't it? Yes, it's not a different virus. COVID is a little bit more complicated because maybe that's not the best example, but at the moment, for instance, I suppose in Holland you also have a lot of flu going around, isn't it? Yes, okay?
Yeah, at this moment, yeah, for sure.
So at the moment there's a lot of flu, and this flu, in general, my experience is with that flu, it produces the same kind of symptoms in almost everybody. There are a bit, like, some people are ill for a very long time, but some people are ill for only lesser days, 3, 4, 5 days. But there is a kind of like a way of how this illness develops, which is very, very similar in most people.
Yeah.
Yes. Okay. So if you want to deal with that illness, a constitutional approach is not so helpful, is it? Yes, because it has not so much to do with. Of course, there is a bit of difference. Of course, if you have already a weak lung, then it will affect your lungs worse than with a person with a very strong lung. Yes. Okay. If you tend towards heat, it will be a little bit different than if you tend towards cold. But on the whole, it's kind of like very similar for most. So it's actually using a constitutional approach would not be so useful there. So if the only tool you have is doing a constitutional thing, what do? Do you understand? Yes. So you need another tool. You need to be able to kind of, let's call it a disease approach. Yes. Okay. Or you need to understand how do acute diseases develop. Yes. Okay. But not only do you need to know how the disease develops, but also, like, say, in COVID, that was very important for me. When I started to treat COVID, it's a disease that nobody knows much about. So one of the experience I had when I treated COVID, so you treat the people, and then sometimes people would get better, but sometimes people would start to get new symptoms as a result of my treatment. And I had to learn which of these new symptoms were a sign that the person was getting better, and which of the were a sign that maybe the person was getting worse, or that my treatment didn't have any results. Yes, okay. So you really need to also know a little bit about disease development. Yes, okay. So for instance, with COVID, I found out a certain kind of nausea was a really good sign, because that meant the toxin was coming out of the body. Or if you have an understanding for the Liu Jing, the 6 Jing, the 6 divisions.
Mhm.
I found very often people started with the Shaoyang stage, and then they would get Taiyang stage symptoms. That meant the disease was going out of the body. Yes,
Yeah.
okay. So that you cannot do with a constitutional approach. Yes, okay. You cannot really do that if you like. Okay, again, an example from my own past. When I studied herbal medicine first, I was taught very much in a kind of like a TCM style, make syndrome diagnosis. Um, but at that stage, when I was learning, nobody really had none of my teachers really understood Shang Han Lun or Wen Bing. It wasn't around then. Yes.
Yeah.
Okay. We did Shanghai in my herbal course. We did Shang Han Lun in 3 hours, everything.
Yeah.
Yes. Okay. So you basically say you use Yin Chao Sum and somebody gets a cold. And if they have some symptoms left afterwards, maybe use Chai Hu Tang or Zhi 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 Tang. Yes. Okay. Something like that. That was all of my Shang Han Lun. Yeah. Okay.
Yeah.
So really, people didn't understand at that time. People didn't have a good understanding of how to treat really good understanding of how to treat acute illnesses. Yes, okay. So for that you need other tools. Yes, okay. So meta practice is what I call meta practice. Is I've learned a lot of tools. Yes, okay, and I try to find a way of not just of using them together, but not just in a simplistic way, like like saying, okay, for acute diseases you use that, for chronic diseases you use that, but how can these different approaches mutually enhance each other? So when you have an acute illness, as I said, like the flu, okay, that's going around at the moment. Okay, it has a trajectory that is very similar in most people, yet your constitution nevertheless plays part in it. Yes. Okay. Yes. So how can I use these two? When do I just go for a disease approach? When do I combine it with a constitutional approach?
Yeah.
Etc. Etc. That's basically. I hope that makes sense. That's meta practice in a nutshell. Yes. Okay.
Yeah.
And there's another really important advantage to this if you do it. I mean, you become a better practitioner. But the other thing that happens is if you're not afraid to work with 2, 3, 4, 5, 6 different, let's call them systems, then they will challenge each other. So, for instance, you say, I don't know, like let's say when you do five element Worsley style stuff, then you know a lot about 5 elements, but you don't know very much about qi and blood. Yes, okay, and you don't know anything at all about Tai Yang and Yang Ming and these kind of things. Yeah, but so if you have a problem, like say somebody has got no, so it forces people when you bring these different approaches together. It also forces you to be more clear in your definition of what do you mean when you say somebody is, I don't know, somebody is somebody has got an earth problem. What does it really mean? How can you how when somebody has an earth problem, is that the same as having a spleen stomach problem? Or when you call something a spleen stomach problem, what's the overlap between calling it earth and calling it spleen stomach and calling it yang ming? Yes, okay. What is similar, what is different? If I call it helps us to become more clear about these concepts that we use in clinical practice too.
Yeah, I think it is a difficulty in the education of TCM now, here in Holland, that all the styles are learned in 3 years, and then maybe the 5 elements, one lesson, and then the Liu Jing. The Liu Jing is now in Qingbai more than a few lessons. And mostly the students are confused what to do because all the different styles.
So they just make like a minestrone out of it, like a
yeah
something like that.
yeah. And I don't know, or the education is that the TCM is learned on another way in Switzerland. But I was thinking, okay, start with something with the chi and the blood and the TCM style, but then also the 5 element and also the Liu Jing and also a little piece of the Shang Han Lun. And then I think the confusion starts.
Yeah.
So I was thinking, okay, get rid of it, get rid of the Shang Han Lun, get rid of, or maybe one weekend, so they can.
But actually, I think if you so one of the thing is you see them as different, yes, okay, but actually they're all part of Chinese medicine. Yeah. So they also, first of all, they all talk about the same person, the same body. Yes, okay. It's like the body that we treat is not a different body. It's always the same body, and we all treat chi, we all treat blood, isn't it? Yes, we all treat a body that is consistent of channels and collaterals and organs and things like that. So I think what you can actually do, I mean, like my course that I teach addresses itself mainly to people who already have qualified, they already have a core understanding. Yeah, so they have already done a TCM education and then probably done 3 or 4 or 5 different stuff, things on top of that. Yes, okay. But I think what you can do if you don't say 5-element and TCM and Tung-stijl and blah blah, they are totally different. No, you can actually see, right, when we talk about, let's say, when we want to talk about chi and blood, what is the best way to talk about that? When we want to talk about, I don't know, the organs, or when we want to talk about the development of an acute disease, what is the best way to talk about that? Can you follow that? Yes, and then you can say, okay, like say, take Yang Ming. Say Yang Ming. Okay, it has got something to do with the stomach, but actually, it's much more to do with how a person reacts to something. Yes, okay. So if a person is always very hot and never cold, and that is what we call Yang Ming. Yeah, okay. Mm-hmm. And then how would that be called, or if you would approach the same problem, somebody who is always hot and never cold and talks a lot and sweats a lot and is very agitated and cannot sleep, how would we approach that from, like, say, a TCM perspective? Yeah, okay, and then we can, maybe we would either call it like a lot of chi excess, or maybe he has got some heart fire symptom. Yeah, something like, okay. So we can say, what we call from this perspective, we call it Yang Ming, blah blah, and from this perspective, we call it heart fire, and okay, from heart fire we can see more clear that. From Yang Ming, we can see more clearly that. Can you follow that? Yes? Okay. Mm-hmm. So then you can say, like take a drug like Huanglian, Coptis. Coptis is really good for the stomach, and Yang Ming, but Coptis is also really good for the heart. So the
Coptis different fuels are coming together in one herb.
Coptis is exactly, Huanglian is exactly what captures where the Yang Ming and the heart fire overlap, so to speak. Mm-hmm. Does it make sense? Yes.
Yeah,
okay.
Yeah.
So if we do it like that, then we can. Then these two things they're not different. They're not the same, but they complement each other. Does it make sense? Yes. Okay.
For sure.
Huanglian is exactly that place where some kind of Yang Ming, not all kind of Yang Ming, and some kind of heart problem, but not all kind of heart problem, come together. Yes, okay. And that's what I mean by metapractice. Precisely that. finding these perspectives um, where those kind of things come together. Yeah. Okay.
Yeah, I agree. But most of the time, the students are confused by the different styles, and maybe the teachers has to explain on a better way um, how to use them or what's the meaning of them.
That's a teacher must, of course, be themselves very deeply familiar with all those things.
Yeah.
Because if you're not familiar with them, then so in order for you to teach the students how to put them together, you need to be able to put them together yourself. And so what I've just explained to you about the Huanglian, you need to be able to see that not just about Huanglian, but like say, I don't know, Chaihu, or you know what. So people call like let's make another example. Okay, when you learn TCM, then one of the things that most people learn when they learn TCM, somebody is stressed. Then they learn to translate stress. They call it liver qi stagnation.
Yeah.
Isn't it? Yes. Okay.
Yeah.
But that is not a diagnosis. That is what I call a translation. You translate one language, the language of stress, into another language called liver qi stagnation. That's a translation. That's not it. So what we need to learn as Chinese medicine practitioners is what we need to make a diagnosis. Yes. Okay. It's kind of like what actually do we mean when somebody has what happens in the body when there is liver qi stagnation. Yes. Okay. So when we say liver qi stagnates, what happens there? What happens to the qi? What kind of qi? You know, is it the qi that circulates in the channels, or is it the qi that circulates outside the channels? Is it the qi that is hot, or is it the qi that is cold? How does that kind of qi stagnate affect the blood, and blah 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 blah. So we need to be really, so when somebody, so like say for instance, somebody gets very stressed, and when they get very stressed, they get one typical thing is when people get stressed, they get pressure in their chest and they can't breathe properly, isn't it? Yes, and they can get a little bit agitated here in the chest, and they can't breathe in properly. Yes, okay. So actually, if we think about that, what happens then when they get tight in the chest, they can't breathe in the chest? Well, that's a stagnation of qi, but the stagnation of qi here is a certain the qi cannot go down in the body, really, isn't it? Yes, okay, it can't go down. And that's why we can't breathe in anymore. Yes, okay, and that's why the chest starts to feel full, because we cannot make our qi go down. Yes, and when you ask these people to breathe into their stomach, they can't do that. Yes, okay, because everything is in. But that's not liver qi stagnation. Yes, okay, that is qi stagnation, but it's qi stagnation because the qi is stagnating in the chest, and actually it's really full here, but it doesn't go into your stomach. Yes, okay. But for historical reasons, stress gets called liver qi stagnation, and then they call this symptom liver qi stagnation. So metapractice also is a way of learning to be clearer in your to not call something liver qi stagnation when it got nothing to do with your liver. Yes, okay. Now another person, they might feel really tense in their stomach, isn't it? Yes, and they get stomach pain, and they get bloating, and they get sudden diarrhea, and they have the same stress. Okay, that's a qi that wants to go up, but it can't go up, and therefore it goes down into your bowels, etc. Yes, so that is much more perhaps liver qi stagnation. Does it make sense? Yes.
Yeah.
And then what you can do, okay, in which person, when you see them, like if you have that experience, then you can teach a student, oh, look, these kind of people, they look a bit like that. And maybe you can use 5-element diagnosis. You can say, oh, these people who look a bit green on the side of their face, and they look like that, they probably tend, when they stress, more towards that liver qi stagnation. But the other people who are a little bit, I don't know, thin, or they may be a bit more pale or flushed in their face. Maybe they more this kind of in the chest blockage of chi. Yes, okay. So then you say maybe they. So that's looking at things from different perspectives, but coming to the same. It enhances your diagnosis, and because it enhances your diagnosis, it enhances your effectiveness in clinical practice.
And how do you know what to use when you are using Metapractice or you are using different styles?
No, I teach people how to bring all these things together. So like for instance, I explained to you just this example. The ultimate goal is to look at the patient. Yes, so not make a diagnosis based on a terminology or whatever. So, but to look at the person and then try to use your different tools that you have. Like say, okay, this person is always they are stuck here. So then you say, are they hot or are they not hot? No, they're not hot. So therefore, it has got nothing to do with yang qi. Yes, okay. So they don't say I'm hot, I'm not. They just say I feel blocked here, and I can't breathe. So therefore, it has got nothing to do with yang qi. It's got to do with I call it Tung qi. It's got just something to do with the qi. But another person, they also might feel very tense in the chest. But then when you ask them, it always has got something to do with up flushing, and when I feel tense in my chest, I also get really flushed in my face. Here's clearly something happening also with your a change in temperature. Where does a change in temperature come from? It must something to do with the qi in your body that generates heat. Yes, okay. So there are very simple rules that you can follow that help you to what we call a differential diagnosis. Yes, that help you. And then if you know somebody is always hot, or somebody tends to react to the stress with the heat, then you can say, I can look at it. As I said before, I can look at it from a Yang-Ming perspective, or maybe I can look at it from an organ perspective. If I look at six Liu Jing perspective, somebody is always hot is a Yang-Ming person, but if they are sometimes hot, sometimes cold, then they will be more like a Shaoyang person or a Zheyin person. And then you put all those different things together. You look at it from different, and then become clearer, and then you become clearer and clearer. You narrow. It's kind of like you keep narrowing the circles of. Does it make sense? You start with this on the outside. Is somebody who has qi stagnation? Yes, okay. But then you keep narrowing it down, and then it's this.
Yeah.
And then you also need to, of course, know a little bit about your herbs or your acupuncture points.
Yeah. And that's why Jan Soon said it's happening in my head.
Eventually it happens in your head, yes?
Yeah,
okay,
but thinking, and yeah.
I mean, ideally, like when you practice this for many, many years, then a lot of these things become more automatic, isn't it? You don't need to think about them all the time because you've been doing that thinking already 50 times. It's like, it's like cycling or ice skating. Initially,
or driving in your car. Yeah. I remember the first time I drove in my car, and I was thinking, "Oh, gee, what is left and what is right, and what to do now?" Huh?
Exactly. Yeah. Okay. Yeah. So you start with a comment, and then it becomes easier as you go on. Yeah.
Yeah. Do you think the TCM education, because in the Western countries we use TCM education, is the best education to start with? And it's also in Holland is also a 3-year education. And I was talking to the school owners, and we were talking about maybe it's better 5 years, but everybody keeps it in 3 years, and I'm saying no, make it 5. It's better.
Yeah, of course, 5 years is better. You can learn more. Yes, okay. Like medical school, they do 5 years. Yes, okay. But I mean, you also have to remember one thing: whatever we do, it's wrong, isn't it? Yes, okay. If once we will do it 5 years, then people will complain it's too long. When you only do it a year, then people will complain and say it's too short. But of course, 5 years, 5 years, especially if you do acupuncture and herbs together, then that 5 years full-time education would be very nice. Yeah.
Yeah.
I would agree with that. Yeah.
And yeah.
But sorry.
And the TCM diagnosis tool, and maybe the Lifa Fang Jiao style. So first search the symptoms, make your diagnosis, and then your treatment strategy.
Yes, but I think you can come at the diagnosis from different ends. Like sometimes, for instance, you can come at, okay, I really, like for instance, I said to you before, like for example, I really know for this person, Huang Lian is good. Because I figured that out in like for instance, in the way that I described before. So then I know Huang Lian is good, and then I can go from, oh, Huang Lian is good, which Huang Lian formula would be good for him? Does that make sense? Yes? Okay, so then I can work my way back from the formula to the diagnosis. It doesn't always have to be like a linear, you don't, symptoms,
linear
strategy,
process.
Sometimes I think the diagnostic process, if you want to teach, is, and lots of experienced practitioners, they come to the same metaphor. It's a bit like being a good detective.
Yeah.
And a good detective, they don't work, in a format. Yes, okay. A good detective is, and that's what another, if you're just talking about the diagnostic process, a good detective, a good practitioner must have the skills to see what is important and what is not so important. And they must see that or feel that, be able to use their senses to have a feeling, oh, this is just noise. Yes, okay. And this is really important. So beginning practitioner, they will always do like an hour and a half with the first patient. And then after an hour and a half, they collected lots of information, but they don't know what to do with that information. But a really good practitioner, they look at the person, it must, and then what a really good practitioner, they have an ability to listen, an experienced practitioner have ability to listen, to see, they see already, and then they just ask 2-3 questions or feel the pulse or they confirm it, and then they know. Yeah. Okay. But that is something that you learn as you go on. But it's like a detective. Where you start, but sometimes it's okay to start at the end with a formula, and sometimes it's really important to start with the beginning, with the symptoms, and then formulate your treatment strategy. Yeah.
Yeah. Yeah. And in your course, you are using also the different diagnosis modalities.
Yeah.
Is that also the Japanese abdomen diagnosis?
Well, I use a lot of abdominal diagnosis, but I mean, in this course that I'm teaching, is I only have so much time, so I'm not teaching abdominal diagnosis. I say the abdominal sign would be that and that. Okay. I'll say the pulse is like that and that, or that is what you would see. But of course, I think palpation is a really important tool. I think in diagnosis, no matter what you do, you should have like 2-3 different perspectives, and it's like I don't know how you when you how do you say in English, when you want to build a road, and then you need to, the guys they use these instruments to look where is a point on the map.
Yeah.
So you have to look at it from that side, and you have to look at it from that side, because where the point then comes, where the point is where these two lines meet. Yes, okay, yeah. And that's what we need to do in Chinese medicine as well. We need to look at any problem, I think, from at least 3 perspectives. Yes. And if all those 3 perspectives meet on the same point, then you can be pretty sure that this is where your problem is. Does that make sense? Yes? Yeah. Okay, so if you, I think it's blood stasis. Why do I think it's blood stasis? This is patient who has got quite severe pain, and the pain is kind of like pretty localized. So I think it's blood stasis. But I mean, this could also be cold. It doesn't have to be blood stasis. It could be cold. It could even be heat pain. So I do my abdominal diagnosis. Yes. So I find, oh, this person has got oketsu. Then I do oketsu. Okay, that's also blood stasis. Does it make sense? And then I look at the tongue, and in the tongue there are some kind of yudian, like purple spots. Also, I have 3 signs that tell me it's blood stasis. Pretty. Chances are pretty good that you really have blood stasis. But if it's only a localized severe pain, like for instance, when I don't know how people these days teach, but when I was taught gynecology, PCOS, like endometriosis. Yes, okay, so very severe pain. Yeah, okay. So everybody would say, oh, this is blood stasis, must be blood stasis. Very severe pain, periods, blood, must be blood stasis. But most of the time it's not blood stasis. Yeah, very often it's heat. Sometimes it's cold. Yeah, okay. Just because it's severe pain doesn't mean it's blood stasis. Yes, okay. So if we look at it from 3 different perspectives: pulse, abdomen, symptoms.
Yeah. But that's difficult when you are telling about endometriosis, because a lot of study books are telling endometriosis is blood stasis.
Well, a lot of
and blood stasis generates heat, and that's why there is heat.
But sometimes it's the heat that generates the blood stasis.
Blood stasis also.
Does that make sense? Yeah. So people have, I mean, most important is what we see in our own clinic, not what's in the books.
No.
And I think a lot of the books, we have to read. You know, I'm a practitioner, but also you read a little bit about me. You probably know I'm also an academic. So academic, we learn to be critical, and it's very different than learning to be an academic. Is very different than learning to be a Chinese medicine practitioner. In academia, we learn to be critical. You read something and you're taught to be, why does he say that? What is the assumption behind? Couldn't you do it differently? Yes. Whereas when I learned Chinese medicine, is the master says this, so therefore, it has to be true. Yes. Okay. Actually, I think we need to be in Chinese medicine also learn to be much, much more critical of, and I could give you so many different examples. Yes. Okay.
Yeah, but I'm a little bit thinking about that. A lot of teachers are telling in their lessons, blah 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 blah, and it is you can look it in the Naijing Shuwen, or because it's written in the book, then it's true. Then it's true.
Everything. I mean, like the Neijing is a little bit, or the Shanghan. I mean, they've been around for 2,000 years, and no, I'm a little bit cynic. Like I'm not. Don't take me. I think these are incredibly valuable books. Yes, okay. And I was teaching yesterday, and I was giving a quote from the Neijing, and it was quite amazing, the information that was in those 2-3 lines. Yes, I had when I was teaching and when I was reading, that's it's so brilliant what's in these 2 lines. Yes, okay. It looks like banal, but actually, depending on how you read it, there's okay. However, at the same time, over the last 2,000 years, people have read in the Neijing and Shanghan all kinds. The one person reads it and says, this is in there. And the other person reads it and says, that is in there, isn't it? Yes, it's a bit like the Bible. You have
everybody's own
and
truth.
Catholics and Lutherans and and everybody can read in it. People can also read in it what they want. So I think we have to be, we have to be. Like for instance, this I can speak with 100% authority on it, because I devoted a few years of my life to do that. As a, for instance, one of the things you learn is that menopausal hot flushes is kidney yin deficiency or kidney yang deficiency. Yeah. Okay.
Mm-hmm.
Now I've done the research. I know. I talked with the people. This is a group of doctors in Chengdu in the 1950s getting together, being told by the government, we need to come up with, there is menopausal problems in Western gynecology. Guys, we need to be able to treat this with Chinese medicine. So what is the syndrome in Chinese medicine? And for reasons that, if you want me, give me 15 minutes, then I can explain it. But these guys came up with kidney deficiency.
Yeah.
It's not in the Neijing, it's not in the Shanghan, it's not in the Yuan dynasty, it's not in the Qing dynasty. This gets invented in the 1950s. Yeah. Okay. I talked with the people who were on the committee. Yes. Yeah. Okay. Right. And it's not based on having treated that for 500 years or this, but it's a fact now. And because it's in a book, isn't it? Yes. Okay. Mm-hmm. It's like because it's in the book, but it's not a fact. And in clinical practice, most of the time it doesn't work if you treat it as kidney deficiency. So you need to learn what you need to. That's a good example of we have to read it critically, and we need to read text again and again and again. That's also what metapractice is about. It's reading texts critically. And then also in light of our own experience, and also in the other part of what I do when I teach this metapractice. I mean, biomedicine is of course also it's a certain kind of practice, and sometimes making Chinese medicine speak with biomedicine can be very, very useful. But as long as you are aware that, for instance, biomedicine information changes, isn't it? Yes. So biomedicine tells you, like say PCOS as an example. Yes. Okay. PCOS, like if you look at the gynecology textbooks, look at Machiocha's book. Yeah. Okay. About PCOS, polycystic ovary syndrome.
Yeah.
He says, all PCOS is always kidney deficiency, and it's always dampness.
Yeah.
Now, he says it's kidney deficiency because for him, and again, there are reasons for it, I could explain to you, whenever there's a hormonal problem, he calls it kidney deficiency. That is because because Chinese medicine at a certain point, TCM, they read hormonal problems as kidney problems. Yeah. Okay. So that's why they call them kidney. But in fact, women who have PCOS, they often don't have a hormonal deficiency. They actually have a hormonal excess. They have too much testosterone. So it's not a deficiency. If anything, it's an excess. And secondly, nowadays, having polycystic ovaries, first of all, you don't have to have polycystic ovaries in order to have polycystic ovarian syndrome. It's not Secondly, they are not cysts. They are follicles. They are the normal egg follicles. There's just too many of them. It's very different from having a cyst. Does it make sense? Yes?
Yeah,
okay.
Yeah.
But when Machiocha wrote that book, he didn't know all that stuff because biomedicine hadn't gone to that stage yet.
No.
So again, we are stuck with some outdated biomedical knowledge on which the TCM is based. Does it make sense? Yes? Okay. Biomedicine has already moved on, but Machiocha is like the Bible of gynecology. You know what I mean? Yes? Okay. So we need to be aware of these kind of processes. Yes? Okay. Yeah. And then if you want to become good practitioners.
Yeah, to learn.
Yeah.
Most of the time I'm telling to my students that when you want to learn TCM of Chinese medicine, that you start with the TCM education, and that's the primary school. And then
Yes.
go on. You can finish after primary school. Oh, yeah, it's okay. It's
No,
what you want,
but
and
yes,
then go on and start with your practice and
that,
feel
that,
what's
that's a
happening.
that's a good way of putting it. Yeah,
Yeah,
you have to start somewhere. Huh?
yeah, and then you can go on to an higher education, to a master,
Yeah,
or
yeah,
everything what you want. Yeah,
yeah.
yeah. I heard some other teachers who were telling we need another book. Also, Felix. We talked about it. We need another book than Mashosha. But I think Mashosha is a great book to learn the basics. I think.
As long as you read it carefully,
Um,
because you know.
I, I will say it. I put it on another way. Mashosha maybe is now the best book
Okay. Yeah.
available to learn it.
Yeah. Yeah. Sure.
Yeah? Maybe the Sang Fu book of Jeremy Ross also, but there's no explanation, a
Yeah.
big explanation in it. When I started to learn the TCM education, I read the book from Kepchuk, The Web Has No Wi-Fi,
Oh yeah.
because there were no other books then.
When I started, there were no books.
No.
So, so when the web that has no weaver came out, that was, of course, the very best book there is. Yeah.
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 Yeah. I like to read it because the explanations and maybe a little bit more storytelling thing.
Yeah.
Because
No, I still
Mashosha is
recommend.
structured, bam, 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 bam.
Yeah.
Yeah,
I still recommend it to lots of people. Yeah.
yeah, yeah.
Yeah.
I like the structure.
Yeah.
Hey, Volker, you are giving this Metapractice education in Switzerland,
Mm-hmm.
because you're also living in Switzerland.
No, I
Oh,
live. No, I live in at the moment in the winter. I live in Tenerife
oh, okay.
in the sunshine, and in the
That sounds better.
it's very nice. And in the
Yeah.
summer, I live in Berlin, and in last few years, I've been living in Berlin and in Italy.
Okay.
Yeah. So I used to live in England for 40 years.
Yeah.
Had my practice there, but after Brexit and a few other things, I decided I wanted to have a change.
Okay.
The reason that I use the course we teach it in Switzerland is I wanted to teach it in English, so I teach another course in Germany, also Metapractice course in Germany in German. But so because I'm German, but I also wanted to teach it in English. Last time I taught it in Holland, but we finished that in at the end of last year. So now I'm starting a new 3-year course, and Switzerland is in the middle of Europe. It's easy to get to, from north,
Everywhere.
south, east,
Yeah.
west. Yes, okay. And yeah, so I want that's why we put it in Switzerland. Yes, okay. So it's 3 years. It's 4 weekends a year. 2 of these weekends are in person, in close to Zurich, easy to get to from the airport, and 2 are online.
Yeah.
So one doesn't have to travel. So one only has to travel twice a year. And in between, we also have tutorials and some video-based learning in between. I've done it now for 3-4 times this course, so it's getting better because I know better how to structure it. One learns as one does it. Yes, okay. So I get good feedback. I know that the concept works. Most people afterwards, they feel they're better practitioners. So
Yeah.
I'm
And
happy with it.
yeah, yeah. And is it for a herbalist or acupuncturist or both?
No, it's for herbalists. Yes, it's so this course is really the conceptual bit. Anybody can use it, whether you're an acupuncturist or herbalist. But the translation of the conceptual things, like say, I explain a certain type, people will learn much better what qi is and how to work with qi. However, So anybody can use that, whether you're an acupuncturist or herbalist. Yes, okay. But then I'm not teaching, oh, these are the points that you can use, or this is the needle technique you should use for that.
Mhm.
I teach these are the herbs for that, and these are the formulas for that. So the clinical practical part is herbal based. Yeah, okay.
Okay.
It's because I've been teaching herbal medicine for the last 20 years. I'm a better herbal medicine teacher than I'm an acupuncture teacher.
Yeah. And do you have to know all the herbs, or?
What is all?
Yeah. Yeah, we are
I
learning, I think, 400 herbs.
oh
But
no,
I'm
not. I'm trying to keep it. I'm not the intention of the course is not to teach you 15 new herbs. Yes, okay.
Mhm.
It's not to teach you any protocols. The intention of the course is to help you to become a better diagnostician and a better thinker and a better practitioner in Chinese medicine. So I don't want to overload you with, well, I give people lots of information. Yes, okay. I give them basically, you can talk to some people who've done the course in Holland, like Felix or Mareike. You know Mareike, yes, okay.
Yeah.
So I give them over 1,000 pages of handouts. Yes, so it's an actual book that they get. Yes,
Yeah.
okay. However, I'm not going to give anybody. There's very few new prescriptions. It's more like work well with what you already know. Yes, okay. So if you know 100 prescription, 120, 30 prescriptions, 100, 150 herbs, that's already yeah. I guide you where you can learn more.
Yeah.
So if you want to learn more, these are the herbs you have to look at. If you want to learn more, these are the formulas you have to look at. If you want to learn more, this is a kind of diagnosis. Like if you don't know anything about abdominal diagnosis, that's what you should learn. Yes, okay. This is where you get additional information. Yeah, okay.
Yeah.
But I'm not trying to give you loads and loads of protocols and loads of new formulas and loads of new herbs. Yeah, work well with what you already have.
Yeah.
That's the goal.
Yeah, and then build further with your knowledge.
Yes.
Yeah. And it will start the 14th and the 15th of September.
Yes. So first weekend in Switzerland. Yes.
Yeah.
And if anybody is interested, they can write to Chiwei in Switzerland, and
yeah, I will write it down in the show notes.
Yeah,
from the podcast, so they can click on it.
Yeah.
And then search for the more information.
Yeah.
Okay. Wow. One last question, because I've a few questions and they are already answered. Is TCM one style? Is it more the Sang Fu style, or is it already different styles together?
It's both. It's both. Historically, TCM got created in an attempt, because China got, the new China after 1949, when during the 50s, when the Chinese government decided that Chinese medicine would be part of the overall healthcare system in China. Yes, okay. So they made the decision: Chinese medicine is going to be part of our healthcare. Yes, okay. We're not going to abolish it. We're going to keep it, and it's going to be part of our healthcare. And then it moved into, the official healthcare system, into the universities, into hospitals, etc., etc. So then they had to create kind of like a university-based tertiary education system. So what you need textbooks, isn't it? You need to make sure that the person who is educated in Beijing, you can also put them in a hospital in Canton.
Yeah.
Yes, okay? And they're not totally different. So you need to make some kind of, and also it was supposed to be a medicine for all of China. So you're not just using, what the people in Shanghai like, yes, or the people in Sichuan, they like to use loads of foods, yes, okay, but that's Sichuan style. Yes, okay, we need to make Chinese medicine for everybody in China. So in that sense, you could say it was, it very much is they brought like some really good doctors from all over China together in Beijing in the Academy of Chinese Medicine, and they created a kind of like TCM is a kind of like a way of trying to put lots of different things together, make one out of it. Yes, okay. However, that is a very particular way of putting things together, and at different periods in China, Chinese history, or maybe in Korea, or maybe in Japan, people have brought things together in different ways. Does it make sense? Yes, okay. So therefore, it's also a style, if you want to call it like that. Yes, it's a style that the Chinese government created at a certain point for a certain reason. Yes, okay. But it's also a style. I mean, like in China itself, it's like exactly what you said. People would go to TCM school. In China, it would be 5 years or 6 years. But then afterward, that's primary school. Yes, even if it's a university degree, but it's still your primary school. And then afterwards, they would study with that teacher, or they would decide, oh well, I do more Shanghan and I do more this, and so you can go, and it doesn't. It's not like everybody comes out is exactly the same. Yes, it's a first
step to make.
Step, and for that it's okay, isn't it? Yes, okay. Like you said, it's like what you said about the Machacha book. Yeah. It's a good introduction. It makes sure that you're not doing harm. You know what the chi is. You know what blood is. Yes, okay.
Yeah, you can start working with it.
Yeah,
and then maybe every breath you take is TCM after.
Yeah.
Every step you make. It's like the song of the police. Huh?
Yeah, I know what you're talking about.
Yeah. Thank you, Volker, for this nice conversation.
Thank you.
Dankjewel voor het luisteren naar deze podcast van TCM Lover. Op www.tcmlover.com vind je online tools ter verbetering van jouw vaardigheden als student Chinese geneeskunde of als beginnend therapeut Chinese geneeskunde.